Thank you.
Assalamu alaikum, good morning. I'm here to present today a comparative study of health policy of KPK and Jiangsu. These are two provinces. Actually, if we analyze that what is health, health is a state of complete physical, mental, spiritual, social being and cannot merely be the absence of disease or infirmity only. What is a health system? A health system referred to as healthcare system. It's the organization of the people, institution and resources that deliver healthcare resources to meet the health needs of the targeted population within a society. Before designing any sort of policy, we have to answer basic 4 questions. That is what, where, how and when. For example, what? To design a primary healthcare center. Where? In Jiangning district. How? To utilize the available and scattered resources. When? To accomplish it till June 2024. Health and economic development are two important standards of human progress. Good health is fundamental pursuit for all, and good health is the human capital necessary to create economic wealth. These are the China statistics. Over 1 million healthcare centers and primary healthcare centers, tertiary healthcare centers are so far introduced. I am going to talk about the statistic of Jiangsu. Jiangsu has 719 primary healthcare centers, in which 713 are affiliated with different institutions, while second affiliated hospital are 485, out of which 463 are affiliated with institutions, while third affiliated hospital are 415, out of which 203 are associated with different medical institutions. Now let's talk about healthcare system existing in KPK. Government funded facilities, parastatal health systems, private sector, civil society and philanthropic contributors are contributing towards the health system. A major strength of government's healthcare system is an outreach healthcare center operated by the lady health workers and CMW, community midwives, and other communist-based workers who have earned success and truth and trust in the communities. And more than their 50,000 Hakim are registered as well. They are also working. This is the organizational structure of the health secretariat, which is conducted by health ministers on top, then health secretary, and these 20 provincial management services are gonna manage the overall health services. And this is the Directorate General of Health Services. They are managing the same, but actually more complementary. And this is the overall structure existing in KPK. That how many teaching hospital, civil hospital overall. There are 9 teaching hospitals, out of which there are MTI, medical training institutions, and overall there are 15 institutions. 371 are the most, there are several dispensaries, there are primary healthcare center, overall are 15. 9 category, as I told you, that there are 9 teaching hospitals, 63 category D hospital, while category B 13 hospital and 26 are category C hospitals. These are the variation which in the last decade the total population is 84.77 million of Jiangsu, which is accelerated to 85.15, almost half million, and the KPK 35 to 37, 2 million accelerated in the last couple of years. And these are the statistical figures that shows the intensity and the priority of the healthcare system. So it clearly express the these figures clearly express the potential and outcome of the Jiangsu healthcare system. These are also the numbers of the officials and the human resources which exist. Actually, this is the price list variation, that how KPK is gonna expand and how the Jiangsu is gonna expand. For example, the admission fees for inpatient is 2.5 RMB. Here is 20 RMB, and for example, blood group and everything. So there are a lot of difference. In such a low amount, the KPK is gonna produce the healthcare services for its masses, while they are expending a lot of for this. Actually, I meet a health hospital director who told me that the patients are our customers, not our patients, as they are preventive and curative measures. If they are gonna not implement the curative measures and then decide they are coming towards the hospital, they are considered as customers rather than patients. That's why they are charging more than everything. These are the MTI which I taught, that out of 9 teaching hospitals, there are 8 MTI medical training institutions. They are after provincial autonomous given to the provinces, they designed this MTI medical training institutions. They improved the utilization of the hospital resources as they are autonomous, so the political and the secretariat is not involved anymore over there, and overall the services of the hospital are improved. This magnifier actually shows the gaps existing between the two provinces, as the hospital analysis, diagnosis, the investigation, and overprescription. Overprescription actually exists on both sides. Over there, where medical representatives are gonna prescribe that right this and this, and here the hospital director are gonna advise the staff that to do this and this. In this study, we have observed the major inequalities in KPK and Pakistan. For this purpose, we have designed 4 different questionnaires: Annex 1 for the policymakers, Annex 2 for the hospital directors, Annex 3 for the medical professionals, while Annex 4 for the patient, the final stakeholder. And after this, major finding are in the communication gap are primary, primary and tertiary hospital, or the lack of referral system, existence of overprescription, lack of basic facilities in primary healthcare centers in both samples, while political interference and nepotism really exist in KPK. Need of the day is to utilize the available and scattered resources for the development of health policy, as good health policy can run good health system, and healthy society will ultimately boost the development of a country. My recommendations are that actually the BHU basic health unit and the primary healthcare center, overall they are operating for 5 hours. That can be accelerated for 2 shifts or more, and to implement the registration, just like CNIC and everything are made, so there must be DNA test and other things, and to conduct those DNA tests to establish interlink communication between the primary hospital and the tertiary hospital to reduce the load on the tertiary hospitals, and to increase the counters of the emergency as well. Alternatives of medicine should be also utilized. For example, Ayurveda, yoga, Greek medicine, cupping, leeching, Siddha, homeopathy, traditional Chinese medicine, so that to reduce the burden on the tertiary hospital. Beside this, natural products should be also motivated to utilize. Comparative study overall, these are the outputs that EMR, electronic medical record system, or HMIS, health management information system, is implemented in Jiangsu, while in KPK still it's manual. Data is on fingertips over here, while it is not over there available, and there are some sort of opportunities as well for China and Pakistan as well. China is the emerging superpower on the surface of the globe, while Pakistan is rich in resources and share 24-30 kilometer border on Afghanistan, so it's really an opportunity. China can provide technological and economic assistance to ensure and launch updated health system, while Pakistan can play a role, bridge between 2 countries, and strengthen relationship in healthcare center to implement electronic healthcare technological system in their local languages for the ease of the poor masses, as it is implemented in Chinese and everyone can access. And I told you that over there it's still in manual system. Around about 2 to 3 million people are coming every month from Afghanistan to KPK to avail healthcare services. CPEC can be also utilized as initiating, designing health policy amid the 2 nations. Future is based on data. Need of the day is to focus on securing health data. Thank you.
Thank you. I'd like to ask you a question. So why is the satisfaction rate a bit higher in Pakistani hospitals?
You know, here the protocols are really followed. You know, the medical protocols, everything is here is followed. While in KPK, when our patients are coming to hospital, they are giving painkillers and they are just became silent. So whenever the patients are coming, you are asking them, so they will tell you that he is satisfied, she is satisfied from the health services. While here, if the patients are coming, you are asking them. I conducted the survey of 280 or about people, so that's the result of that. So the patients are coming and saying that in China, so 50-50.
easier for a Pakistani doctor to prescribe painkiller compared to a Chinese doctor, right?
It's the practice and the routine over there.
Thank you.
Okay.